Pat Allen, Director of the Oregon Health Authority, and I'm delighted to be able to be here to participate in this launch of the Oregon Convention Center mass vaccination site. I particularly want to thank our Portland metro area hospital partners, Providence, Legacy, OHSU Health, and Kaiser Permanente, for doing the hard work over the last several weeks to work together to launch this joint site. As you'll hear in the presentations today, doing this together at a site like the Convention Center will allow a much greater volume of vaccinations to be done in the coming days and weeks ahead. And I really appreciate their work. We've made a lot of progress in Oregon in terms of ramping up our vaccinations. Through yesterday, we've administered 238,000 doses across the state. 4.6% of our population has received at least one dose. And this past week, we averaged over 12,000 doses per week. Several days hit 15,000 doses. Before we received a large shipment of Moderna second doses today, we had administered 65% of the doses that were available to be administered in Oregon, which was the 8th highest rate in the country. As I indicated, we've received a large number of doses today, including 72,000 Moderna second doses, and so that number has dropped back down, but will continue to go up as we work through those new doses. I'm really excited about the work that's being done all across the state, here at the Convention Center, Salem Fairgrounds, and other locations to increase our throughput of vaccine. We're now at a place where we can administer virtually as much vaccine as the federal government can provide us. Every single location around the state is going to be capable of administering more shots than we will have vaccine available. And so we're looking forward to more vaccines becoming available as part of the pipeline and being able to increase that throughput to get people vaccinated quickly. Being vaccinated is the best way to protect yourself against the coronavirus. But while we're waiting to get people vaccinated, we need to continue to remember to wear masks, avoid large gatherings, wash our hands, and stay home if you're feeling sick. So thank you. And with that, I'm going to go ahead and turn it over to Wendy Watson, Chief Operating Officer at Kaiser Permanente. Wendy.
Thanks so much, Pat. So I am very excited to announce our joint partnership that we're starting at the Oregon Convention Center today. Kaiser Permanente, Providence, Legacy, and Oregon Health and Sciences University are very eager to play a part in what Pat just talked about in terms of vaccinating all of our Oregonians. I'd also like to acknowledge our Salem Health partners who stood up a mass vaccination site in Salem and gave us the opportunity to learn from them as we set up this site at the Oregon Convention Center. So why are we doing this? All four systems really share collective goals in achieving herd immunity for COVID so we can protect our population against COVID, as well as get our schools reopened, our businesses reopened, and really return Oregon to life post-COVID. We know and recognize that by working together, we can do a lot more and we can do it faster. By pooling together our vaccine doses, our workforce, our collective partnerships across the communities, we really can do this a lot faster than we can do it on our own, which is why we're doing this together. We will be at the Convention Center vaccinating in alignment with the prioritization as set by the state. So we're currently still working our way through phase 1A. We will begin with the educators next week, and then we'll begin working our way through those over age 65 in the age ranges, again, as established by the state. We will be partnering with Oregon Health Authority and local public health on making sure that we're also vaccinating our vulnerable populations and that we're equitably distributing the vaccine within those priority phases. We're setting this operation up as a sustainable operation that we will run until we no longer need it. So this isn't a short-term event. This is something that we will have running for months. Our ultimate goal is to have it open 7 days a week, extended hours. We will scale up over time as vaccine supply is available to those hours. This week, Kaiser Permanente is starting. In fact, today we have the operation running. It's working very well. And then very excited on Monday for all four systems to come together and begin the joint vaccination. Behind the scenes right now, we're working on syncing up our systems so everything works together seamlessly once we start on Monday. So with that, I will turn it over to Joe Ness.
Great, thank you, Wendy. Good afternoon. I'm Joe Ness, Senior Vice President and Chief Operating Officer for OHSU Healthcare, and it's really a privilege to be here with you today. OHSU is excited to join Kaiser Legacy and Providence in launching a mass vaccination clinic at the Oregon Convention Center to help protect our communities from COVID-19. Collaborating with other health systems and community partners to stand up scalable vaccination sites aligns with our core mission to improve the health and well-being of all Oregonians. We understand that the vaccine distribution system is imperfect, and we're disappointed that Oregon did not receive additional doses from the federal government this week, but that's not slowing our efforts to put systems in place to deliver vaccines that will protect the health and safety of millions of people statewide over the long term. The Convention Center Max Vaccination Site would not be possible without the determined efforts and expertise of hundreds of dedicated health professionals, from logistics and pharmacy to scheduling, technology, and patient care. Each team member has committed to leaving their badges at the door and developing a program to service all Oregonians. Work groups with representatives from each health system have worked nights and weekends to quickly build a shared scheduling and staffing model to safely and effectively register, vaccinate, monitor thousands of individuals as they become eligible to be vaccinated over the coming weeks. To start, our blended teams will vaccinate community members in Phase 1A, including individuals with disabilities and their caregivers, followed by the school district employees, individuals over 80, among other groups following the state's direction as vaccine supply allows. The number of vaccinations administered per day will continue to grow, as Wendy mentioned, and when more doses become available, more Oregonians become eligible. Our ultimate goal is to offer a vaccine to any Oregonian who wants it. OHSU has committed its entire organization to do whatever it takes to get vaccines in arms of as soon as possible and as soon as they're available. We're using multiple approaches, including the Convention Center Max Vaccination Site, large-scale drive-through clinics, and mobile vans. The end of the pandemic is in sight, but we must remain vigilant. The vaccine is effective, but until enough people get it, it's important that we continue the protective measures that we've been following for months, including wearing a mask, physical distancing, and hand washing frequently. If this pandemic has taught us anything, it's that we all have an enormous impact on one another. Getting vaccinated when you're eligible will help protect you and others from getting COVID-19 and help our schools and economy fully reopen. Thank you for doing your part.
Good afternoon. My name is Trent Green. I'm the Chief Operating Officer for Legacy Health. It's an honor for Legacy Health to be a part of this unprecedented effort. As health systems, we've worked together in the past on smaller projects, and we've seen how collaboration benefits the community. The size and scale of this effort is beyond anything we have tried before, certainly in the time frame with which we are moving. But the pandemic has taught us that we must find new ways to overcome challenges we never imagined. One of those challenges is not just vaccinating our patients, our community, and our state, but it's ensuring we properly document who has been vaccinated and ensuring that the people who are vaccinated have that documented in their medical records. A common electronic medical record has never really demonstrated more importance than at this moment for us as providers. We're fortunate as a community to have such a common platform. So the EPIC electronic medical record, which we all use, will help ensure that each patient has an accurate record of their vaccination history. Regardless of whether someone seeks care or where they seek care, each person will have proof of their vaccination. Let me be clear, there's a lot of work that we need to do here, and let me also be clear that we are committed to making this work. I actually firmly believe that the standard we set here with this effort will bring long-lasting benefits to our community. There's another benefit to a common EMR besides having the vaccination documented. There's the benefit of having a central source for registration and notification. We'll receive more vaccine in the future, as has been mentioned by Wendy and Joe. And so having a process, an easy way for people to register in advance of receiving their vaccine enables a smooth and easy process when it is their turn, so they can be notified, find a time that works for their schedule, sign up for an appointment, and ease the process when they actually arrive at the convention center to receive their vaccination. We have already seen that doing this in advance of the process will make the process much, much easier and smoother. As I said, there's a lot of work that still remains to be done, but we're committed to doing this work. We do need your patience. I know people are anxious, and after months of this pandemic, it is really hard to wait. I can tell you our phones are ringing off the hook when people want to know when and where they can be vaccinated. We just want to encourage you to be patient. We are working as quickly as we can. Calling your doctor's office or calling the hospital cannot speed up the process, nor can calling the doctor's office or the hospital change which phase you're in. We are committed to working with the Oregon Health Authority to ensure that people know when they are eligible to register and where they need to register, and then smoothing out that process to really easily facilitate the actual administration of the vaccine and the registration for their second dose of the vaccine. Thank you. I'll turn it over now to wrap us up here, my colleague William Olson with Providence Health and Services.
Thank you, Trent. My name is William Olson. I'm the Chief Operating Officer for Providence in Oregon. And I'd like to first start out today and really recognize my colleagues here on the call, Joe Ness at OHSU, Trent Green at Legacy, Wendy Watson at Kaiser. Today is basically the accumulation of when we started meeting back in April. So as we saw the pandemic taking hold and our hospitals, the beds were filling up, we knew we needed to come together as a tri-county group to really work together, share information, and really get ahead, or try to really get ahead of the COVID-19. So I really do appreciate that collaboration. And without that collaboration, starting back in April, I don't believe we'd be where we are today. So a big part of that. So today, though, we're coming together to do what we've all been doing individually at our hospitals and clinics for almost a month. And I got to tell you, it feels it's been longer than a month. Now that we vaccinated our caregivers and other groups of 1A, we collectively have a lot of experience, and we're excited to be able to offer our expertise to the community at the Oregon Convention Center today. We all know vaccine clinics require a great amount of coordination, and that starts with scheduling, and you've heard Trent talk about that. And as people arrive at the convention center, we got to ensure too that they're wearing masks and being socially distanced. So to give you an idea of all the different roles that we've had to stand up pretty quickly over the last few days, is we have greeters and wayfinders to help people navigate inside the convention center so they know where to go. And we're pleased that from the community has come together, and we now have a lot of volunteers who have signed up for these non-clinical roles. So really a great outreach to the community. We have registrars who help people with the paperwork and with checking in. Nurses for private consults if they have clinical questions. Clinicians to administer the vaccine and monitor people for the 15 to 30 minutes after their shots to watch for any side effects, which, as we all know, has been rare. And I want to give a special thank you to the universities, the students out there. They've been a significant help in this pandemic to us. They've provided a lot of the vaccinator roles in our clinics, and they'll be with us going forward as well. And we can't forget about the pharmacists as well. Those are the people who are mixing the vaccine and filling the syringes. Add in all our partners then for the Oregon National Guard and the people who have stepped forward from every major health system. And to do this in such a remarkably short time, all of us at Providence, Legacy, Kaiser, and OHSU are grateful to be a part of this work. It really has been an amazing effort. And so at this time, I will conclude, and we'll now open up to questions. And please raise your hand, and Michael Foley will call on you. Thank you.
Hey, Pat, Doris, do you have question, and please remember to unmute yourself. I cannot unmute you.
Okay, I think I've done that. Can you hear me okay?
Yes.
That's the new question for 2021, I think, that we're all asking. So I have several questions. One of the things that we're hearing from a lot of people is, okay, where do we go? There's been talk of this central portal that people can go sign up for. Does that exist? Is there a common medical record yet? What is this costing the health systems, for example? And is the federal government going to reimburse you? And then maybe somebody could just talk about the logistical challenge of getting your employees, who I assume are already busy working at their first jobs, getting them in to take care of this. So thanks for answering all those.
So this is Trent Green. Maybe I can tackle the first. I think I heard 3 questions. So let me tackle the first, just as it relates to scheduling and common electronic health records. So yes, there will be a scheduling tool. We are actually already utilizing this at Legacy in the administration of vaccine to our employees and our community partners. We've been administering vaccine for well over a month now. It's a scheduled process. So what'll happen when we're ready is there's a URL, and we will communicate with the groups who's next. Right now it's I don't want to say it's easy, but we are working on 1A population. So we're working on healthcare providers. We have lists and lists and lists of healthcare providers that have been provided to us who have not had access to the vaccine. So what we're able to do is push to them details on how the process works and a URL. We'll be able to do the same thing with teachers. Actually, the teachers are they're an organized group. The school districts know who their teachers are, and so we'll be able to communicate with them when we are ready. Here's the process, here's the URL to sign up for a time. When we get to more of the community, sort of general population, we're still a couple weeks, 2 to 3 weeks out on that. So we'll have more details on exactly how that process is going to work, but there will very likely be, and OHA has already stood up some things on their website. We'll figure out if we can link to their website, perhaps, that you go through an eligibility check, and then assuming you're eligible, then click right to our URL to schedule a time. So I don't have the definitive details on that for you right now, but there will be a scheduling link. We'll have ample appointment availability that will be based on what our vaccine throughput is at the time, and it has already been tested. It is working extraordinarily well, and then yes, that will go into an electronic health record. So you'll schedule for your first one, and then you can schedule for your second one right then, or you'll get a reminder afterward through the electronic system that it's time to schedule a second appointment. Let me stop there, and I'll let maybe one of my colleagues pick up questions 2 and 3.
Yeah, thanks, Trent. I'll pick up the third question around workforce. So this is definitely a concern that we're actively working through. I mean, obviously, all of our physicians, clinicians, nurses, pharmacists, they are all also providing healthcare non-COVID related back in all of our systems. So factoring that in, the way we're addressing this is we're trying to tap as many other resources above and beyond our core clinical staff to help staff this vaccination center. This is why the National Guard plays a key role. They're helping us to fill some of the vaccinator roles. We've been able to tap retirees, so retired physicians, retired nurses. We have hundreds of people that are volunteering to come help vaccinate. All of the community agencies that are offering up volunteers also help us to fill some of the roles you heard about today, greeters, wayfinders. As we fill those with volunteers, then that doesn't make us rely on our clinical staff to have to do that. So all of that then, and then pooling our workforces across the 4 health systems also helps us. If we're each doing this independently, and then it's much harder to staff, but we'll be able to share resources across the systems in addition to all of those other roles that I mentioned. So it'll still be a concern, but it's one of the big advantages to doing this together at the convention center.
Thanks, Wendy. And I'll take the cost question in there because I've been involved with the Oregon Hospital Association. In fact, I led the group around looking at what would it cost to stand up these mass vaccination sites. And so we've gone through a process to really fully understand what I talked about earlier, all the different roles that are required, the IT systems that we have to set up, and actually even the location itself, and in this case, the Oregon Convention Center. And we've developed a cost model. Now, I will say we have to refine that model because, as Wendy pointed out, there's a lot of volunteers. And in fact, our experience at Providence in the first month is 90% of the vaccine was delivered by student nurses. And so there was a lot of staff that we didn't have to pull off the units who were dealing really with COVID at the time. So another group will come together, and as we understand how much of our labor will be pure volunteer and how much of our costs will be those people that we will actually ask them to take a role at the convention center, we'll refine that cost model.
And let me wrap up by taking a crack at the payment portion, Pat, of your question. The vaccines have already been paid for by the federal government, and so there's no cost there. But as William just outlined, there are operating costs and that can be significant. Vaccinators are entitled to receive an administrative payment for each vaccination, and those administrative payments are covered either by the Oregon Health Plan, by Medicare, by private insurance, or by a special fund that's made available for people who don't have insurance. It's likely that that administrative fee is not fully going to cover the cost of administration. And so we're working together now with the hospitals to use federal resources that just got provided to us at the end of last year through the most recent federal coronavirus bill to provide supplemental payments that will help close that gap and pay other vaccination costs around the state, not just in mass locations, but in the mobile settings that were mentioned, and as well as work done by local public health and community-based organizations.
Great, thank you. And then maybe just one follow-up, maybe to Mr. Allen. Will they have enough vaccine to be able to do what we're hearing, 7,500 a day, maybe 7 days a week?
No. No one's going to have enough vaccine at the current distribution rate for anything that they can do. As I indicated, we had several days last week at 15,000, and every single vaccinator that we had contact with last week while we were doing 15,000 a day begged for more vaccine that just wasn't available to allocate to them. I was just on a large call with hospitals, local public health, and others today, and we talked about the fact that we'll be releasing allocations tomorrow, and everybody is going to be unhappy because everybody is going to be able to vaccinate more people than we have doses for. Right now, we continue to have been given guidance that we're going to expect about 100,000 first and second doses a week in the state. Maybe just a little bit more, 2,500, 2,700 more than that. But until we either see new vaccines be approved or see production go up significantly, everybody in the state, including this operation at the convention center, will be capable of vaccinating more people than we'll have vaccine for.
Okay.
I can add.
Okay, go ahead. Sorry.
Sorry, just to add one other data point there. Because of that, we're essentially starting at about 2,000 per day. So we're building a scalable model. So we'll start at 2,000, which is about the vaccine availability that we have to work with now. We'll be able to ramp up to 5,000, 7,500 per day when vaccine supply comes. In the future, if we get additional vaccines or vaccine supply really starts flowing, we can ramp up even more from there. So we'll really be able to utilize the convention center to go at the pace that the vaccine supply allows.
Lashay Wellesley, would you like to ask a question?
Yes, thank you. I wanted to ask a question. We heard from a viewer that was turned away and told that there were no vaccines in the Portland metro area. I was just wondering, I mean, we're hearing from a lot of people who are frustrated in phase 1A who haven't been able to access the vaccine. So what do you tell people who want the vaccine? And then the other question, in terms of, we have a new federal administration, new president, what do you need from the federal government to make this rollout a success?
I can take the first part of that. So I think, in terms of other members who are in the 1A category, we would encourage you, if you're representing, an employer group or something, to work with local public health to get on a list that then we can work with our public health colleagues and make sure that we get scheduling slots available to them at convention center site or other sites. And as far as what we need from the federal government was we need doses, we need vaccine.
Yeah, let me take the second part of that. And Joe's exactly right. We need more vaccine, and so we need vaccine that's in the pipeline, the approval pipeline to be approved, and we need more production of all vaccines or more purchases of vaccines that are available. But we also really need some predictability in a couple of respects. You've heard about the fact that everybody can use more vaccine than they're getting. And knowing how much we can expect to get week in and week out is really, really important. I was glad to hear from General Perna that they had backed off the notion of fluctuating allocations based on how much you would use, because that removes that predictability from the system. But knowing after the end of February whether the number is going to go up would be extremely useful right now for us to know, so that plans can be built about where to allocate that, what kinds of systems need to be scaled up, and those kinds of things.
Could I add just one more comment to that? Today we come at the scheduling from 4 different systems, health systems, and each system is very different in how you get signed up for the vaccine. And we found gaps and holes in all of our processes. So the fact that we can come together and work off of one system, none of us like to turn people away. And so the fact that we can get on a single system, one that basically invites people in, that they have a pre-scheduled appointment, will eliminate a lot of people just showing up out there. And so, again, I think that's just one of the values of us coming together.
One follow-up to that, once people sign up, how do you verify that they are actually eligible for a certain phase?
This is Trent Green. I'll take that. So in the beginning, we're actually, as William just mentioned, we're taking lists from organizations. So we're getting lists from, we're working with the Tri-Counties actually very effectively. They have long lists of healthcare providers that have not had access. And so it's helpful for us to have them aggregate, and then they send to us, and then we're able to kind of moderate basically the flow of scheduled appointments to match what the demand is or the supply of vaccine is. So that's why there's a lot of, don't think this is a political statement on teachers versus seniors, but there's a lot of wisdom actually in going with the teachers first, because it's an easy, Barlow School District knows who all their teachers are. Portland Public Schools knows who their teachers, janitors, bus drivers, et cetera are. And so it will actually allow us to test a lot of our systems before we go to wide open public scheduling. So there's a lot of work to, in the beginning, we're getting lists from people. Once we get to the age bands, that'll be pretty easy, right? I mean, people will be able to put in what their age. That's actually one of the sign-up requirements. You have to put in what your age is. The other thing that in the early stage, Director Allen has some eligibility kind of trackers. There's a tool you can use to go in and see whether you're eligible. I will say we hope everybody is bringing their best self to these. So right now it is attestation. So if people get an invite, we're asking them to attest that they are actually qualified for 1A, assuming they've been able to actually schedule an appointment. So again, in the early stage, it's relatively easy because we're getting lists of groups that we can communicate with directly. Those are the healthcare providers. It'll be the same with teachers. And then once we get into the age bands, it will be a little easier. The eligibility will just simply be what age band are we in, and what's the age of these individuals.
Next up is Jacqueline.
Hi, everyone. This is Jacqueline with Coin6. I have 2 questions. One of them is we've had some people reaching out asking their retired nurses looking to volunteer. How can they volunteer? And then my second follow-up question is last week, I believe it was Rachel Banks with the OHA. She did mention that OHA is working on a site to kind of connect people to find out when they'll be eligible for the vaccine and where to get it. Is there an update on that site?
Let me take the site question quickly first. That site is should be available shortly if it's not already, and we're doing media availability on Friday and can talk in more detail about that.
And we're certainly excited to welcome any and all volunteers that are qualified to be vaccinators. So we'll, certainly retired healthcare workers and such, as long as we have, they're licensed and capable of delivering the dose, we're happy to accept them as volunteers. I think we'll get better as time goes on, moving beyond just our own health system, which is obviously where we're most connected and most easily find the volunteers initially. I know we're already in some conversations with the school superintendents about bringing in some of the school nurses as volunteers as well. So I think that over the coming weeks here, we'll get more deliberate about how we reach out and ask for others to help participate.
Yeah, and again, I think the comment I would make here as well, each health system has a volunteer methodology that works. As we're coming together though, we've asked our staffing team to really develop out that volunteering process. So more to come on that as they work together. So Wendy, I don't know if you want to talk or say anything about that process.
Well, yeah, I was going to add that as well. Like, we're each individually doing that, but as we come together, we're going to come up with a better system that will really be across all four. And then we'll partner with the state as well, because there is a volunteer site through Serve OR. And so we want to pair up with that as well. So we'll figure out the most efficient, effective way to leverage volunteers, because we'll need as many as we can get.
Thank you.
Yeah. Amy?
Yeah, it's Amy Green with the Oregonian. Thank you. I have a few questions about using the Oregon Convention Center. Can you walk me through the process, like how it will work? Is it indoors? You park your car, you walk in, and it's a large space where people are being vaccinated. Why not do this outdoors? Was there any talk of a drive-through mass site in the Portland area? Because as we know, the UK variant is rapidly becoming more prominent here. Another question, if you could answer how many mass vaccination centers there are right now in Oregon, and how many mass vaccination centers will there be in Portland? Is this the one and only that we're planning on sending everyone to in the Portland area, or are there some other locations that you have planned to open?
So let me start on the first one, and then I'll actually have my colleagues weigh in with some details, and maybe Pat can take the last one there. So yes, it's inside. One of the reasons we set it up as an indoor walk-in is Oregon weather and the time frame that we're in the year right now. And drive-through, and I'll have Joe speak to a drive-through model that they're using. It's lower throughput, so it's got advantages, for example, mobility challenged people, but you can get a lot fewer through, just because primarily the constraint of the observation period after the vaccination. So from a process in terms of walking in, and maybe Trent can cover what happens before you arrive. But when you come in, you'll be greeted, there will be a line. It's set up very efficient. You'll come in, you'll get registered, then you will go to a vaccinator station. Once you've been vaccinated, you'll go to an observation area. Depending on risk factors, it'll either be a 15-minute or a 30-minute observation area, and then you'll leave. In and out, it's pretty quick, very efficient. So that's just a high-level overview of the process. But Trent, I don't know if you want to cover what you do before you arrive.
Yeah, so as I mentioned, with the scheduling tool allow people to select an appointment, appointment window that works for them. They are able to go on, secure that appointment time, and then there'll be basic information that they'll input, demographic information, just as you would if you were going to a doctor's visit. You'll type in basic demographic information, select the appointment time, and then when you present at the convention center, it'll be a smooth process. We are being very mindful of space. We're putting dots on the floor for social distancing. It's a big space. We're moderating throughput to ensure that it will be safe. All the observation areas, chairs are spaced 6 feet apart. Which is why we really believe in this model and the scheduling model. You've all seen pictures in other news outlets of lines and lines and lines of people. We want to be the total converse of that in the model that we are we're building here, and that's why, again, the scheduling tool is so important. But it's a very quick sign up, but not dissimilar from what you put in when you are going to see a physician for a regular office visit. The type of demographic information you put in a form.
Let me tackle the second piece of that, Amy, which is there are hospital systems working with local public health all across the state to stand up, or having already stood up, as in the case of Salem, mass vaccination sites. And the biggest issue we're having right now is how to supply them with enough vaccine to make them efficient and allow them to be high throughput. I've had conversations today with a couple of counties that are ready and hospitals that are ready to go, but don't have enough vaccine yet to be able to do that. And so that's our biggest limiter on how many of these we can do around the state, is how much vaccine we have available. We'll have more details at our press availability on Friday, talking about coming plans for these sites in different parts of the state.
And I can just add a little bit on the mobile test or the mobile vaccination sites. So as many of you know, we've been doing mobile COVID testing at 2 sites, at the Convention Center garage and out at Hillsborough Stadium, for the last many months. And we've kind of perfected that process and understand how to manage the cars and the lines and the flow and staff being outdoors and that kind of thing. So we opted to move the vaccination weekend opportunities that we had at those 2 mobile sites into a single site out at Portland Airport at the Red Lot. That will be going live tomorrow on a small scale appointment only for phase 1A folks, and we're ramping up through the weekend, and then we'll have to take a hiatus as well next week, as we just won't have enough vaccinations to both contribute to our efforts at the convention center and at the airport simultaneously. But again, much like what we're doing at the convention center, where we're building the infrastructure and the capability to operate every day for months. That is what we're doing at the Portland Airport in partnership with Red Cross. So we're excited to have that as an option. But as Wendy pointed out, it is certainly a less efficient operation. It takes more volunteers to get the same number of doses administered to a patient. But at the same time, for those that are challenged with mobility, it's a nice option to have. So we look forward to advancing that as we go forward, and hopefully twist the arms of my colleagues here, and we can get some additional volunteers from their systems as we move forward with that site in the coming months.
Joe, just to follow up to that. Yeah.
I mean, can I just a couple of comments here? Just so I think we all realized as we got into this effort just what an enormous challenge and mission we have as healthcare providers to help facilitate this. There are 4.2 million Oregonians. If you assume for a minute that we need 70% of them to get the vaccine to achieve some level of herd immunity, that's 2.9 million Oregonians that need to receive the vaccine. But they got to get 2 doses. And if we want to accomplish this mission in any sort of reasonable time frame, say by the fall, that means we have to have the capability to vaccinate 25,000 Oregonians every day, 7 days a week, in order to be done by sometime in October. And so what we realized is that scale is so important. We have to come together. So to comment on, is this the only one? Yes, the 4 health systems are unified in this. There will be what I would refer to as kind of tuck-in opportunities. So we know there's populations that aren't as mobile, and so maybe the drive-through opportunity is the way to go there. There's very likely going to be very hard to reach populations, and we might have to have strike forces that we can work with the counties to go out and address those particular communities. But in terms of high throughput and consistency, as Director Allen said, that's a real critical thing we need. We need to run this every day, and in order to do that, we felt the best way was to link arms and do it together. I will say, I think other parts of the country are realizing this. Just, if you consider Vancouver part of the metro area, just this week they started efforts to scale up a mass vax, high throughput, they're referring to it as a vaccination center at the Clark County Fairgrounds. So there'll be that in Vancouver, our operation here, what's happening in Salem. There are some discussions I know about Woodburn and potentially kind of a mass vax, maybe a little smaller scale, but mass vax in Woodburn. But we really believe this is the way to go to administer as much vaccine as quickly as possible into Oregonians. And as Wendy said, we're building this so we can scale really quickly. Our only constraint will be vaccine availability. So we've designed this to go from, we're going to start at 2,000, but we've designed it to go from 2,000 to 25,000 if we had the vaccine.
Joe, just a quick follow-up. So the airport vaccination sites that OHSU is temporarily going to be running, you foresee that being operated in the future and for the general population?
Yes, we're committed to it for long term through the course of the next many months. And whether it ever reaches the point where we'd be open access, not scheduled. We haven't crossed that bridge yet. We're, at this point, as long as we can identify groups that can be scheduled and stay in accordance with state guidelines on that, that is allows for a much more efficient and smooth operation with people not risking being turned away and that kind of thing. So we've got a lot more thinking to do. We'd be capable of opening it up to the general public without schedules, but we're not there yet. It's going to be many, many weeks, I think, before we get to that point.
Amelia, you have a question?
Yeah, two questions sort of related. The appointmenting system, will that be online only? And if so, how do you expect people 80 years and over to use it? And then second, what ability will people who primarily speak Spanish have to access the system? Will it be in English and Spanish? And do you have volunteers with those language skills as well?
Yeah, our planning horizon is like 15 minutes. So you've moved into a space that we're not entirely there yet. So yes, we'll have a process for people that don't have technology, phone number, etc. So details to be forthcoming on that, but we totally get it. Not everybody has access to electronic capability, and so we'll have that. And in fact, we've got a team that's actually actively working right now on kind of a call center type thing, because we'll have people who have problems even with the technology. It didn't work, so we're working through that aspect. And yes, we're going to have interpreters at the site. We are working on multiple languages, just as we have now for our patients that speak Spanish, or we have lots of opportunities for them, both in written form and verbal form, to communicate with us. So all of those aspects are being addressed and accommodated.
Okay, we don't have any more hands up. Would anybody like to ask an additional question? Otherwise, we will wrap it up. Thank you very much all for coming. We hope this was useful and able to address most of the questions out there.